Okay, so we will just begin, and I may have this in the wrong order, but we will start with nominations for chair. If anybody would like to nominate someone for chair.
I nominate Clarence for chair.
Okay, we have Clarence. Any other nominations for chair?
I'll just say that anyone else who would like to run is more than welcome to run.
Any
I've
other
been chair for
nominations?
more than 20 years.
Yeah, I'll nominate Rich.
I'll
Okay,
give someone else a chance.
any other nominations? Okay, we'll close nominations, hearing no more, and all those in favor for Clarence, please signify by raising your hand or saying aye.
Guy.
All right, so I think we have five
Okay.
for Clarence, and those who would like to vote for Rich Huber for chair, please raise your hand or say aye. We have, we have three. So Clarence is going for the record, and he is our chair once again. So congratulations, Chair. And I
Probably
turn
set the
meeting
record a
over
long
to
time ago.
you. You're just cementing it now.
All right, thank you. We'll now entertain nominations for vice chair. Laura?
I nominate Rich.
I'll nominate Buzzy here for, he'd be good at that.
Any other nominations? Are there any other nominations? Any other nominations? And I'll entertain a motion to close nominations and cast our ballots.
So we'll.
Second.
Motion made and seconded to close nominations and cast our ballots. All in favor?
Aye.
Motion carries. Okay, show of hands or aye for those who wish to vote for Rich Huber.
Aye.
1, 2, 3, 4. I think I counted 4.
I was on that too, if you didn't get me.
Okay.
And welcome for Rich Huber.
Okay, so that makes 5 then. All those in favor of George Bossé for vice chair, vote now. 1, 3. So it looks like 3 for George, so Rich is our vice chair.
Vice chair. Oh.
All right.
It's a
then
tough
we'll-
campaign.
I see call to order and roll call. I don't know, that should have been
I
at
know,
the
I
beginning.
probably should have been.
So we can pretend that we did call the meeting to order. Public comments pertinent to agenda items, resolutions, ordinances. Anyone wishing to make public comments?
We're not on the agenda. I don't believe we're able.
You,
This isn't pertaining to the agenda, so we were thinking we were waiting to the end, but we would.
Oh, this would be the time.
This would be the. time.
yeah, I mean, technically. Public comments are only supposed to be for items on the agenda.
Okay,
That was our understanding.
yeah, so we don't.
So we're willing to wait till the
Yeah, we
end to
can-
make our.
Well, this would be the only.
This would be the only time that they could do it. We'd probably have to have a suspension of the rules, I suppose, if they're.
This is Laura. I'll make the motion to suspend the rules.
I second.
Okay, motion made and seconded to suspend the rules to allow comments on items not on the agenda. All in favor, signify by saying aye.
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 Opposed? Okay, motion carries.
Okay,
Go ahead.
all right, thank you so much. My name is Lisa Green. I'm actually the new office manager out at Hubs of Joy. And so, I had reached out to Terry, and I know I didn't give her much time to get back to me, but we had this opportunity and Diane was able to come too. So we thought, my biggest concern is I love to deal with people when I see them face to face. And so, I just wanted to be able to, have you guys put a face to a name and vice versa. So,
Where did you say your office manager?
Hooves of Joy.
Homes of Joy.
Hooves.
Hooves of Joy. Ah, got it,
Right,
okay.
we're therapeutic.
Well,
Yeah,
yeah,
I
horse
just
meat
said
stuff.
horse- Yeah, just south of town here.
Right.
Anyway, I know we're not currently working with Ashland County, with the one program that they were, but I'm very optimistic that we can remedy that for the future. So that's why I wanted to come and introduce myself. We've made some changes, that I also wanted to say. We've created three different new staff positions that are filled to help with the administrative and the financial end of things, to help us, be as efficient as we can, as timely as I can with any reporting requirements and those types of things, and to have someone specified to be a contact, that is familiar. So that, like I said, that was my main concern. I brought a handout here that has our entire team, which I'm not really sure, how aware. You can tap and pass them around. I think there's like 10, I don't know if that's enough to go around, but it just shows how many people are involved and how much we want to provide a safe and quality service and also be in compliance and be professional about everything we do. So on that note, then I also want Diane to get a chance. She's also came on board. She's helping with the financial end.
Can you imagine that? I'm a CPA. So, and I'm also a horse crazy person, so I think the only person who knows me is Clarence.
George.
And he probably knows I'm a horse crazy. But anyway, so Hooves of Joy, is everybody familiar with the program?
I'm not, no.
So Hooves of Joy is, it's a riding program for disabled, individuals, and we had a contract, Hooves of Joy had a contract with Ashland County, and we lost it. And I think it was because there wasn't anybody doing the bookkeeping. I think that's the bottom line, because when I was looking at the audit that was just completed now, December 29th of 2023, for 2022. The audit itself was great. It's called the unmodified financial audit. That's awesome. They passed, but identified a lot of areas which were bookkeeping in nature and having an active board and certain things. I just want to let you know, we have taken care of everything. We've already had our third board meeting this year. We're really trying to turn things around. We really want to put the track back. So I think Terry might be the contact person that we could. And there's been a lot of children who are not able to get the same service anywhere else because Joy allows those children to ride a horse.
And if I could just interject though, another reason I got involved with Clubs of Joy is I actually ride there. I have a form of muscular dystrophy and I am a huge advocate for horseback riding as a alternative form of, therapy for people that have physical disabilities. And, I've been riding there for close to 2 years now. I have been a horse person my whole life. But I was told by many medical professionals throughout my life that the reason I have the mobility I have, which isn't the greatest, but it could be worse, is because of riding at such an early age and continuing to ride on a regular basis. And it breaks my heart. I used to see, the kids when I'd go there to ride and how much joy and how much benefit they were getting. And like I said, it's a great program. I utilize it myself. That's why I'm willing to be here today and I wanted to help in any way I could. and I can't volunteer by being a sidewalk or a horse leader or all the things I'd like to do.
But I do.
But I can help in the office, so, again, I just wanted to put that in there, because like I said, I personally know the benefit.
Can't ask questions.
Okay, fair enough.
Oh,
You can't-
afterwards,
You're right. You're right.
we have the contact information on there, I'm sorry, did I take the time?
Nope.
I think either one of us would be glad to answer questions after, or, if that's legal
I
or.
think part of our presence here today is we want to start somewhere, and I don't know.
Yeah, what's the
protocol
next
is.
step?
So we're here, I'm seeing, so you're Terry Barningham, I'm Diane Forrest, so I'll be contacting you. And we'll proceed and see if somehow we can somehow help these children who are not being provided the service that they really need and want. So that's all I have to say, so thank you.
Thank you very
Okay,
much.
thanks.
Yeah, thanks.
All right, we'll move on to approval of the February 21st minutes of the meeting. Anyone have any additions or corrections you need to make to the minutes?
This is Laura Negro. I will make the motion to accept the minutes as presented.
I'll second it.
Motion by Laura Negro, seconded by Rich. To approve the minutes of the last meeting. All in favor signify by saying aye.
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 Motion carries. End of year to date expenditures. Amber.
Everybody got a copy of it, even though it's online. So we don't need to share it if we don't, if everybody has it, but. So, this is 2023. This is everything that we've had entered to. Probably both beginning of last week. It is not final. I do anticipate there will be some changes, because we're just closing out, in the next month or two, and then with the audit, and then some more adjusted entries, so we'll have if there's some major changes, I'll bring it back, but, so definitely not final, there will be some more, but, overall, we're kind of sitting where we, anticipated, we anticipated being over our levy amount. You can see the majority of that is in the children's and family, section, which it's what we talk about all year round. We knew it was gonna happen, mainly in that one item, so they were, significantly over what we had budgeted. Which is why we increased it for this year, so we can try to, we hope that this year won't be as much. And then, but every other department looks like they were able to come a little bit under as of right now. So that we have a net of 155,000 over at the moment. Any questions on that so far? I did include last year's where we were at this point too, so you could compare it to that one.
Thank you for that.
You're welcome. Does anybody have any questions on this? We talked, is it okay if I bring up the next line item that kind of ties together? About the travel?
Yeah, go ahead.
Okay. So, I can't remember if it was Laura or somebody brought that to our attention about it being, our training and travel line. Being over budget. Overall, when you look at it, $15,000 over our total budget isn't, a lot of money, but I did dig into a little bit just to see, and, in public health, which Liz talked about last meeting, that they had a lot of training, and she was over on her training by, just over $6,000, but she did get, revenue for that. It was funded, and that's reflected in her, revenue that is over budget as well. So that's up in there. So that was covered. And the other thing I looked at is pre-COVID, the budget for training and travel was more, closer to 75,000. And then it was brought down over the last few years. And now that everything's going back to being in person, then we're getting less virtual options. So starting for next year, I'm going to be bumping that back up. And I do anticipate that this year, we could possibly be in the same situation where we might be a little bit over on training and travel. But we'll see as the year goes. But definitely have it on my list for, the 2025 budget that I'm gonna bring that back up since that, virtual option is going away.
Yeah, more and more, they're just not even. I think it costs money for a lot of conferences and meetings to have a virtual option. Some were contracting with like Hoover and different organizations that do that for a living and would even make them accessible via some like YouTube or Vimeo later to view, and those are all at a cost, and I think everybody just has decided they want to save those costs, which then pushes the cost back on those of us way up north who have to travel down to Rhinelander or Stevens Point or the Dells, Madison for those meetings, so I do anticipate that our costs will probably mirror what they did last year, and we didn't plan for that in the budget, but again, when we try to minimize it as much as we can, whenever there are virtual options, we try to attend virtually. There's just less and less of that now.
Laura?
I do think, I like that there's virtual options, and at the same time, there's huge benefits, attending, meeting people, talking with people, connecting, maybe finding grant options that you wouldn't have come up. And so I really think that we should be open-minded about the benefit of that. And that was mentioned earlier about Liz and, going someplace and then finding out stuff. And so, I think we would be remiss in not pointing that out.
Any other questions? Now we'll move on to public health update. Liz?
So I just wanted to share a couple of updates. The first one being regarding to our public health harm reduction vending machines. So our first machine has been in operation for exactly a month now. That machine is installed at the Ashland Fire Department. It's in the main entrance vestibule. So it is in a climate controlled area that is available, accessible by the public 24/7. They can just walk in that first door and have access to the machine right there. We've been averaging right around 6 Narcan being dispensed every week thus far that it's been in operation, whether that be the individual boxes of Narcan or the Narcan Go kits. The Go kits include the box of Narcan, a disposable CPR face mask, a set of gloves, and then an information card on community resources and how to administer Narcan. Most recently, we've added the fentanyl test strip kits, and those have been utilized as well. We did have to restock a couple of those already. The second machine has been delivered to Bad River, and we're hoping to have that installed and up and running by the end of the week. I've been working with a couple of contacts to try to get all of that sorted out. And the RFA for the funding period for the second round of funding has come out for that. So we are going to reapply for a line of funding so we can have continued supplies for the machines. The scope of work is limited specifically to the harm reduction supplies to stock the machines. So that's the primary focus of them. And we are in conversations with a couple of different community contacts to see about applying for a third machine, just to kind of spread the wealth. Saturate the community with Narcan as much as we're able. So we are looking at a larger package of funding this time to apply for that, for a third machine for our area. We also do have some Narcan training events coming up for the community. One of the events that we have on the calendar is a training at the Ashland Area Development Corporation for the tenants and staff down there. And then the nonprofit organization Finding Joy will be presenting at the Mellon School District next week. They've previously presented for the Ashland Middle and High School, as well as some local communities. I know they've been in Bayfield, Sawyer, and Douglas County as well. So it's as much of a child-friendly presentation as the topic of the dangers of fentanyl and overdose can be. It was very well received in the Ashland School District, so that's coming up for Mellon School District for next week. And then I just had a quick update for our parks project. It's almost done. We're like so close to done. So far, we've had the new parks at the Butternut Village Hall and Gordon Lake are completed. We contributed funding towards the Marion Park restoration in Glidden. And the Three Rivers Park in Mellon is halfway constructed. There was a bit of a shipping error that occurred, so we actually had to reorder the poles for the swing set because they turned up missing. It's a long story. So those are scheduled to be delivered on the 26th, and then we're just trying to sort out if the town crew will be able to do the installation for the swing set, or if we have to have the installation crew come back to put the swing set up. So I'm just waiting to hear back from the town crew on that, if they're able to do that. So that's all I got.
Any questions for Liz?
This is Elizabeth Brannick. Can I ask anything?
Go ahead, Liz.
With the no-can vending machines, how do we get the word out to educate the using public? I mean, public like the ones that are the drug users. In the last couple of days, there was 2 overdoses, so I'm not sure if these people know where they can get these kits, or, you know, they're kind of out in their element, so I'm not sure how they would get the word out to them. But I think harm reduction would be a good place to start, and I'm not sure, you know, if they are in the know about or even in contact with that organization. But, you know, and what is the liability like? I was even thinking like somebody on staff at Super One, like myself, or anybody that operates, that is a manager, acting manager, I believe they should know how to administer Narcan just in case the worst would happen. And what's your feelings about those? Thank you.
As far as advertising, we've had information out on social media, and the initial share that we had on social media was the number of interactions. So people that actually clicked on it, shared on it, commented on it, did something with it as far as an interaction. The last time I checked it, it was, I believe, close to 900 within the first, I believe it was 3 days. So for our social media, that's a very impressive number of interactions. Usually public health social media doesn't go quite so far.
It's very popular.
Can't imagine why. So that was a very big, you know, boom that was out there. I know it was shared on the Small Town Crime Wave page. I don't remember if that's what it's still called or not. And then a few community posting boards as well. Once we have the second machine up and running, our plan is to do a joint advertising campaign with Bad River. It will be, Bad River Harm Reduction Services will be assisting with stocking and maintaining the vending machine that's placed out there. So we're going to be working with them on advertising and trying to increase community awareness that the vending machines are available. And as far as Narcan training for any local businesses, if you would be interested, please just give me a call, send me an email, and I am more than happy to help set that up for you.
Thank you so much.
Rich, you have a question?
Yeah, you said you have funding for all these machines, so, you know, costs anything, I imagine, but how many machines can you get? I mean, with this funding, you know, I mean, Plan on putting one further down south, or are you planning?
We actually, the areas that we placed the machines in, we had worked with EMS, law enforcement, and then DHS was able to run data through their EMS systems. And we actually created heat mapping of the fatal and non-fatal overdoses in Ashland County.
Okay,
And the goal was to literally drop the vending machines in the middle of the hotspots for where the most common overdoses are. We went back and pulled data for the last 5 years. I believe DHS went back and pulled data for 5 years out of the EMS run reports for non-fatal overdoses. And then our local, one of the deputies was able to create a heat map for us based just on fatal overdoses. So we actually laid those two data sources over the top of each other and essentially pinpointed where the hotspots were. There's two specific hotspots within the city of Ashland, and we're trying to specifically target those areas. The fire department happens to be kind of right in the middle of one.
okay.
And then there was another hotspot essentially in the Bad River area, so that's why we were targeting there. The southern portion of Ashland County actually has very little activity as far as overdose EMS calls or fatalities compared to
Up here, yeah.
where things are more active at this point, so.
Okay.
So it's good you don't get one.
Yeah, yeah.
I'm more than happy to share, but at this point, I'm trying to focus specifically where the data is
Oh,
indicating,
yes, yeah, I can see that.
so.
So, yeah, I want to pay to put one down there, so.
Well, and there is another round of funding, but it will be competitive.
Oh,
And we've
okay,
already received some, so I know from calls that I've been on, a lot of counties kind of missed this opportunity. Probably didn't open the email or see it, and now they're like, oh my gosh, we wish we would have.
Yeah.
And now they've come out with another round, so we may not have the opportunity. I'm sure Liz will try.
Yeah, it's because we have the two machines that we do, we have a very good, we get extra points on the evaluation to get a line of funding to maintain our supply,
okay.
but to get the increased funding to get an extra machine, I need to have a very compelling
Yes.
supporting data for for an extra machine, so.
Where is the other hotspot in the city of Ashland?
Vaughn to 9th, 6th to Main Street. That general chunk.
So then eventually, years past, we'll have to buy the stuff to put in the vending machines, I imagine, right? Because that funding will run out.
I'm not sure how long they're going to extend the funding for, how many cycles.
Okay,
We are also a Narcan Direct provider, so we are able to use our Narcan that we receive through the Narcan Direct program to supplement any stocking of the machines as would be necessary. I did budget heavily for supplies, so I have a very tall stack of
Oh.
Narcan
okay.
in storage right now.
That's good, yeah.
And it is good for 3 years, so I do have kind of a backup supply at the moment that I would be good for a little while if the funding suddenly
Right up.
decides to go away.
But a lot of this funding is also coming from the state, from their opioid settlement funds.
Yep.
So those will continue on for several years, so we're hoping the funding will continue for several years.
Yeah, they had actually doubled our allotment that we had requested through the Narcan Direct program because they had received additional funding through the state for the opioid settlement funds, so. Which is good because I only have 4 boxes left through that line of funding, so I was able
Oh.
to order more through that, so.
Okay, sounds good.
Laura Negro,
You know how there's the little tiny library boxes that there's the mini libraries on each corner and stuff? Is there a way to, say in the southern part of the county, maybe at, say, the Mellon City building, having some kind of supply there, or, to try to, I know you said it wasn't a hot spot, but our county has been hit pretty hard all over with it. Even if
We-
it was, hey, there's 5 kits for each place?
Yep, and that would be something we could do. There are the availability of, it's essentially like an AED cabinet, only it's a Narcan
Yeah,
cabinet. And we do actually have, there's one at the Vaughn Library where we supply them with the Narcan. They just restock the cabinet as they notice it's run out. So those are available. We could, set that up. It does need to be in, as far as storage and handling of the Narcan, it's recommended that it be essentially kept at room temperature, so we don't want it to have extreme temperature excursions where it would be frozen or roasted in the sunshine if it were to be left out.
Yeah.
It does still work, but there is a chance that it could decrease the efficiency of it, so we do aim for climate control.
okay. There might be an aging unit that could use a little box of that stuff. I think we fall into that second category of hotspot, don't we? If I was trying to place a map inside my head, I was trying to picture it, but.
Yeah,
on,
that's
On the
right, yeah,
9th and
yeah.
6th and Main Street. Laura, did you have a question?
And this is sort of kind of related, but do we know if there is like a Good Samaritan rule about,
Wisconsin is covered under the Good Samaritan Act. So anybody can carry and administer Narcan in good faith. So you're administering Narcan as you're calling 911 to have emergency services. There are certain protections and provisions for individuals who, whether they're on probation or have a criminal record, there are certain provisions for them in place as far as using the Good Samaritan law. For school staff, specifically on the school grounds, there's Wisconsin statute 118.29, which is kind of an extra Good Samaritan law for school staff. So for them to administer at school functions or essentially anything school related, they have to complete a DPI approved Narcan training. So the slide that we use, we have gone through DPI, and I do have that specifically approved, so I'm able to provide that training for the school districts in Ashland County.
so if someone's a user and they administer Narcan, but they've been using, will they still be protected?
Yes,
Okay. I
they
think that
can,
really needs to get out there because there's a fear that if I administer that, and I don't make the phone call because I don't want to get busted.
right.
I think there's a big misperception out there, which is why I'm bringing it up. And-
Well, and some of the provisions, and this is the hiccup at this precise moment in time, is some of the provisions as far as parole violations, and I don't remember all of the specifics of it, but some of the provisions did sunset. I believe it was I don't remember if it was 22 or 23, so some of the provisions sunsetted, so it is in the it's a work in progress right now to get those provisions reinstated
Okay,
to ensure that coverage for individuals, that it's, their PO is not gonna be called, that they're still acting in the best interest regardless of the situation. They're helping their friend, they're calling 911, they're doing what they can do.
good. I think a huge campaign for that would be really important as well. Cause I think I know there's misperceptions. Cause I know, I'd take the fifth.
Are there any other questions?
Yeah, Elizabeth Pranick again. Liz, has any outreach done to Madeline Island at all?
They did not register as far as any on the heat maps at all. So as
We could.
yeah, as far as putting a machine there or anything like that, we haven't gone that route. But otherwise, as far as businesses, for anybody that's interested in Narcan training, we, accommodate any request that we can.
That'd be good.
Thank you.
Just to like throw out the thought that, I don't know if the Bay Cinema does public service announcements, but we get a lot of attention if we could get it on their screen.
Yeah,
Hmm,
that's a great. idea.
good idea.
They do all their advertising at the beginning of the show.
Mhm.
Yeah.
Yeah.
Any other questions? All right, we'll move on to behavioral health temporary bed closures.
So actually, starting next week, our Tamarack Health Behavioral Health Unit, for our local behavioral health unit, is going to start a temporary bed reduction from 10 beds down to 3 for some construction, renovations, things like that. That'll start next week. They have to be down to 3 beds by May 6th. And then that'll last for hopefully only 8 to 10 weeks. And at that point, they'll go back up to 7 beds while they redo the 3 rooms that were being used before. So we definitely have some concern. So if we have emergency detentions, it's pretty likely they're not going to be able to go to the behavioral health unit locally. So we're gonna see increased transportation costs if that happens, increased placement costs. But then we also have some concern if somebody were to go in, maybe was at or nearing crisis, they would go into the ER. And if BHU had an open bed and they were deemed appropriate, they could just go to BHU here and get the help with, so then hopefully avoiding the emergency detention and all of those extra pieces. The hospital seems to have a pretty good plan in place for, they will be doing some housing of these folks if they know there will be one of the beds opening in BHU, like maybe the next day or later that day. But it still really limits when there's only going to be 3 beds available.
So I would like
Go ahead,
to
Jo.
comment as a representative of Tamarack Health. I was authorized to bring some additional information since I know they've been having meetings with all the counties and whatnot. They gave me an FAQ list, which will be going out next week, so this is only just for this meeting, and then I'm supposed to take it back with me. I asked if I could make copies, they're like, no, not yet. But I guess the message that they want the community to hear is for one, we're not reducing any of our staffing. So all the behavioral health staff that currently work in behavioral health will continue to work their normal FTE. And what they're doing is they're getting some cross training to, like you said, if they show up at the ED, we may hold them longer in the ED, or if they're maybe appropriate to be on our med surg unit, they may be there with a behavioral health nurse. So the message I was told that I can bring to this group is you don't necessarily have to change your processes for how you would refer behavioral health patients to the hospital. The hospital will work with the patient to determine how to get them the best care within the resources that we have available to us internally.
That's great. Absolutely.
So we have to have it all done by September 30th, I believe. So we have to be back up to 10 beds by September 30th.
George?
Can I ask, what are the improvements or renovations and why is
So
it
that's
being
on my
done?
little cheat sheet.
Yeah.
So I believe this is going out to the employees next week, and then I believe there'll be more press release type of
Yeah.
information with the similar
Just a
information.
caution, we are on a recorded.
But that doesn't
Public
get
meeting,
released
right?
does it go to the public?
Yeah, yeah,
Okay,
just open to the public.
well, I think I'm safe saying, this is what's included in the renovation project, okay? So they're going to, it's mainly, mechanical type of upgrade. So it's an old building. It was built like in 1980s. So it really hasn't had a lot of,
Overloading care.
Okay.
yeah, we haven't had a lot of updating since then. So they're gonna do new windows, siding, windows, doors and roof. There will be a new multifunction addition expanded in our treatment space. We are completely renovating the nurses station and the inpatient unit. We've been trying to do this for a very long time, is to update the HVAC, the heating and the cooling system, So literally, people will have offices across the hall from each other. One person will be freezing, one person will be sweating. So, and you can't update HVAC while it's occupied. You just can't. So you really have to have people out of those spaces, which is why we were doing the bed reduction down to 3, because the one HVAC unit controls one section of the behavioral health unit, and we have another air handler that controls the 3 beds that we're still able to use, and that's why we're still able to use those 3 beds, is there's a different air handler for that space. And then we'll also, like improve like our fire safety things and whatnot, and then, so most of the work they're saying is utility based, is in a nutshell. There's gonna be like a couple spaces we'll have to do flooring put in, new walls put in, et cetera. There's a few other spaces like that, so. Did that answer your question?
Yeah, it's difficult to handle,
Yeah.
huh?
Laura,
So is there going to be any beds added to the BHU?
No, unfortunately not. We're not able to increase the number of our inpatient beds. There's a whole lot of, it's more than just a physical space thing. There's a whole, like, you'd have to apply and get permits, and it's just like we have to be back up to our 10 inpatient beds by the end of September, because otherwise we have to do all sorts of appeal to CMS and all sorts of rigmarole. So we have a very short window, and we have to have it done between May 6th and September.
Okay, I thought when they came to the county board to use our bonding authority and such, that there was supposed to be some kind of expansion, which was part of the reason why the county board was very excited to help with that. So it seems like the project has been scaled different since.
I don't think there was a behavioral health unit.
I thought there was an expansion that was brought up in there too, because we knew we needed that in our area. Because I know plenty of people that get shipped to other places at the current rate of beds that we have. So, okay, I'll have to ask different questions someplace else. Thank you.
Laura?
So probably isn't on your cheat sheet. Do we know anywhere in this room if there is any discussion of augmenting the beds at PHU inpatient?
So that is definitely not on my cheat sheet,
Okay.
and not in the conversations that I'm included in.
Okay. Could you take that back to the people that you chat with that,
Yeah, that's a much bigger, longer conversation.
absolutely, and yet I think what Laura has indicated, and I think probably what the rest of the committee would agree upon, is that we're very lacking
Mhm.
in providing services to our community.
Mhm.
That's.
And we fight very hard to keep the 10 inpatient beds we have,
I'm sure you do, yeah.
so, yes.
George, does your DAC tell you, what the current occupancy is? What's
Current
census?
occupant, like today,
Out of those 10 rooms, are 10 occupied or not?
Usually.
oftentimes we do maintain at least, let's just say 80% occupancy, 90% occupancy. I don't know what the census is today. No.
That's like 7 rooms of outsourcing for a period of months, yeah. Wow,
Yeah, all summer.
scary,
Mhm.
that's scary.
But it's gotta get done too, so that's, we've
Yeah.
been pushing it off, and yeah.
Any other
Elizabeth
questions?
Frank, can I ask, can
Go
I
ahead.
ask a question?
Sure, go ahead.
Does anybody know any, options other than BHU inpatient? Can they utilize Northland Counseling, or are they just don't have room either?
So when it is appropriate, Northland Counseling will absolutely be used. The hospital I know has been in discussion with them. Just confirming what their bed capacity is, what they're able to accept, what they're not able to accept at the crisis bed.
One
And
thing
the
that is,
crisis- And I'm sorry, the crisis bed cannot accept emergency detentions.
Right.
Mhm.
And that's definitely one of our biggest concerns because a majority of our adult emergency detentions do end up placed at BHU. So then we don't have the officer having to sit with them for so long, the transportation costs. The other costs that can be associated depending where they go.
Mhm.
So a very different situation when they can go to BHU versus going elsewhere.
George,
Yeah, I don't know what Northland Counseling is. Can you explain?
Northern Counseling is the company that we as the county contract with to provide our mental health crisis services. And then, so they would be the ones that like approve our emergency detentions and do those assessments. But then they also have outpatient mental health counseling and a 4-bed adult crisis unit. So if
Is that
somebody,
physically here in Ashland?
Yeah.
It is, okay.
yes.
Thank you.
Ashley, have you had a conversation with admin at the hospital? I'm sorry, I can't see you right behind me.
We have through other meetings that we've been on, it's been discussed quite a bit.
Okay,
Yeah, and I've talked with Tom quite a bit.
okay, because if you want me to let them know that you'd like another meeting or something, I can definitely bring that back.
Yeah, I think we have it covered pretty
Okay.
well.
Okay.
Best as we can.
Right.
question for Maddie.
And the county health board requests that Tamarack hold one bed open, I lost it,
For emergency detention.
for emergency detention patients for Bayfield/Ashland County.
I believe that question came up at one of the meetings. And they kind of can't because they don't know exactly what the needs of that emergency detention might be. So if it's a situation where maybe the construction commotion or just the environment wouldn't be sufficient for that patient, then it would also be not allowing anyone else to access that bed either.
any other questions?
I still got a
George, got
question.
another one.
So it's just, you have controlled access beds and then you have non-controlled access beds. Is that right? In BHU? You have bedrooms on the hallways, as I remember.
Yep, so we've got like, there's one section over here, there's a nurse's station, there's the day room, there's some rooms here, there's some rooms here. And then we have the ability to like take this one wing here that's got. There's maybe 3 rooms there, a couple offices and a kitchenette and a laundry room and a shower room, whatnot. We can make that our construction border and seal that off completely. So that none of the behavioral health patients have access to the active construction site. Cause, you know, obviously the safety of the patients are a very high priority. And so we don't like need tools sitting around or, you know, sharp things or things like that. So we have a very definitive barrier. There's gonna be, I don't know if it's a locked door or a wall that's gonna be there. So that you literally cannot get into the construction zone.
Thank you.
Anything else? Okay, next item is high cost placements. Youth and adult.
Ladies first.
So in the adult unit, I would say our biggest one, we have had an individual placed at Winnebago Mental Health Institute since mid-September. Working with the state and their family care organization and prior placements and many other placements to try to find somewhere that this person can go that can adequately meet their needs so that they don't get discharged to a setting that can't meet their needs and then end up right back in Winnebago or another facility. This person has extremely high physical, aggressive behaviors. She's been there since September, but in good news, is supposed to be discharged next week to a placement that has spent many, many weeks setting up this placement to hopefully best serve their needs. I would say that is our primary placement.
The most difficult for sure.
Yes.
The most dangerous to the community and to themselves.
Mhm.
And, so that the fact that we've made this much progress, knock on wood, is hopeful and hopefully it will work out for everyone.
Jerry?
So, unfortunately, mine doesn't have any really good news right at the moment. We were kind of forced into making a placement out of state again. We have a young lady who we had previously placed in a residential care center in Milwaukee when she was 13, and she subsequently ran away from that facility, as they are not locked facilities. And was missing in the Milwaukee metro area for approximately 3 months. Probably went through some sex trafficking, and there's, any other number of things that may have occurred in this situation. Once we ended up getting her back into custody again, we had her at Northwest Passage to have her go through yet another assessment to kind of parse out what her needs were. Their recommendation was again a residential care center. And then they put on the caveat of in a rural setting so that she would not be so inclined to run. Ever since COVID struck, we have had a massive loss of both group homes and residential care centers in the state of Wisconsin for kids. We are down to 4 residential care centers in the state of Wisconsin that will take females. That's it. And given the very few beds that are available in the state, the facilities are being very picky on who they will take and who they won't take. So the caseworker in this case is Carol Burrell. Carol contacted every group home in the state of Wisconsin that takes females, all of the residential care centers, and then had to expand her search outside of the state. She contacted all of the residential care centers in Minnesota. She checked Iowa, Illinois, Utah, Tennessee, Pennsylvania. I don't think we got that far because we found the one that we found. And we ended up finding a slot for her at a place called Heartland Behavioral Health in Nevada, Missouri, of all places, at 1500 Ashland Avenue. Oddly enough. The really significant news there is that it is $765 a day. So that's about $23,900 a month. And that does not include the educational costs, which we will have to pay out of a different pot of money. So it is I just did not want you guys to get blindsided next month when you see the substitute care costs, but just, be assured we will try to keep this stay to a minimum and get her into a less restricted placement as fast as we possibly can. Unfortunately, there's just those situations where it's completely out of our control. As far as, the level of need that the kids have and the level of care they need to be at, so.
Well, and to keep this young person safe, they've
Yes.
been in secure detention at $500 a day, not getting the services that they need, just being basically held for their own protection and the protection of the community. So it's an additional cost, but at least there will be treatment for them there, so.
Sorry about the bad news.
Well, it'll be well worth the money spent, the additional $200-300 a day for the educational component, and certainly I would think the probability for better outcomes, and so.
I did, when I found out that they had approved her for admission. I called a couple of different workers in the state that had also utilized them. And were able to kind of get some reviews, and everybody's been pretty impressed with them so far, so
Good.
fingers crossed.
How did she, sorry,
George?
how did she get there?
How does she get there?
Yeah.
That was actually done by a company called Ready Transport. We felt very strongly that if we attempted to try to drive her there on our own in a non-secure vehicle, she would have jumped out of the car and ran.
Mhm.
There's no doubt in my mind. I think it would have been not only a safety concern for her, but from our workers as well.
Yeah.
So, yeah, we opted to do the Ready Transport option.
Thanks.
Any other questions on either of those two cases? We'll move on to CCS outreach update.
That is me. After our last meeting, we had talked about the homeless population in Ashland and how to reach them. Our staff and I worked diligently together. We got flyers up throughout the community. We set up a time for Thursdays at noon at Pearson Plaza to plan to go down to have availability to meet with anybody that needed support or help. We also worked with the BRIC, so the BRIC resource coordinator, also set up with us to show up and be there in case people needed extra support. So we've been going every Thursday at noon. We have a phone with us, so we can do side-by-side phone calls, help connect people if they need anything. We have community resource brochures, referrals to CCS, kind of everything we could think of to bring. And so far, we have been there diligently, but no one has met with us. So we're still trying, and we're still going down on Thursdays and still have up our flyer and hope people see that, but so far. Nobody is showing up, but we're hoping they will.
Okay.
This is Elizabeth Manick. I heard on the scanner, I think it was yesterday, they had a homeless person sleeping in a dumpster by Goodwill. And then there was a tent set up somewhere that the people alerted the PD and they had it removed. So I'm not sure where those people are.
Any other questions or comments? Matt, jail grant update.
Just a brief update for you. So the grant is effective as of April 1st. We had to make some changes. Our plan was to have a certified peer specialist as the person who would be mostly in the jail and being the connection between the jail and our CCS unit. There was some controversy over whether that person should be, as part of their job duties, able to observe medication administration, not actually administering the meds, just observing it, as we talked about, to make sure that it wasn't diverted or, so either stockpiled or given away to somebody else in the prison, just to make sure those medications were taken appropriately. We followed all of the advice that the state of Wisconsin had given us. It was mute on that point. And we heard back from the state that that wasn't something that they felt a certified peer specialist should do, and that they would probably be changing the guidance that they had given counties on that. So knowing that that was probably coming, we just said, fine, we're changing the job title and the job description, and we are now administering the medications. It will not be a certified peer specialist. It will be a service facilitator or a case manager. They will be more involved because we don't have that certified peer specialist with the limited things they can or can't do. I think it'll actually be better, especially if we can find somebody with that lived experience, which we have it down to just a few candidates. We are going to interview again on Friday, and we should have a decision made by the end of the week and get going on that grant. So we're very excited to get going. It was a hiccup because we could have already for a couple weeks had somebody in place, but because of kind of the information coming down from the state, we had to pause it and go a little different direction. So that should be getting up and running very shortly, and hopefully we'll begin the treatment in the jail and having a real good connection for those inmates coming out and connecting them to our CCS program and other resources and supports in the community.
Laura Negro, do you have a question?
No, I just have a kudos to you guys. I really appreciate it. I've been working on this for the better part of 2 years to push that stuff, and then when you guys came in, it just kind of, it just fell into place, and by that I mean you guys worked really hard and pushed it into place. So I really appreciate that. This is going to serve our community so much better and help our people in so many more ways than what we have been. So you guys are angels.
George?
Terry, I don't think I fully understand the positions. Can you please just get like a 30-second synopsis of the job description?
I have it. So what would have been the certified peer specialist, which is now the service facilitator and case manager, they'll be hired full-time to provide services and supports to inmates who are choosing voluntarily to be enrolled in the MAT program. It will be supervised by our CCS program here, so there will be supervision, and they'll participate in our staffing and be able to do a warm handoff to
I don't even know what MAT program is, so
medication-assisted treatment.
thank you.
So when a inmate goes into jail, they'll be screened to see two things: if they are, if they're appropriate for medication-assisted treatment, the jail nurse will be doing that part of it. If they are and they agree to go in, we also will be doing overdose assessment and training with the jail. There'll be protocols in place so that all the jail staff know what to look for as far as overdoses go. And then this person, they will, now they'll be administering the medications, they'll be observing to make sure that there's no diversion. And then they'll be running some groups. They will be doing one-on-one counseling. They'll be working with inmates before they're being released so that they can make sure they have applied for, if they want to and they're eligible, for Medicaid, for food share, help them with some housing resources, get them connected to clinics in the area if they don't already have a preferred provider. Just a real warm handoff. Hopefully by then, as they're building rapport, they can talk about the CCS program and do a warm handoff to them. That's all voluntary, but we're hoping because they'll have a relationship with this person that there'll be more trust, and hopefully they'll be willing to try this CCS program for continuity of care.
That's great, thank you.
You're welcome.
Any other questions?
I wanted to echo with Laura Negro. Thank you for this program. I've been always advocating for somebody to be a jail intervention specialist to help our inmates that are addicted and, you know, kind of lost in society. Also, does it help this person, will they be able to coordinate them with job centers and or training if they're a convicted felon, if they can't get a regular job?
I guess I would have to say that depends. That depends on how long the inmate's going to be in jail for. You know, if they're going to be in there for a significant amount of time, then they can work on all those resources. If they're in there just for a very short term, that would fall more to the CCS program upon release. And that is part of the CCS program, is the employment assistance.
Thank you.
Any other questions? Next item is resolution honoring Val Lebanon.
Laura first, I move to approve.
Can read the resolution?
You want me to read the whole thing?
Yeah,
Put on your best radio.
They have it on your sheet there.
I think we should hear
Where?
Wouldn't even read the full resolution at the county board. Whereas Val Levno has served many years providing mental health services to residents in Ashland and Bayfield County through the community service program, and whereas Val Levno was integral in developing policies and procedures for and the certification of the Comprehensive Community Service Program, CCS, for both Ashland and Bayfield County in 2015. And whereas Val's efforts were crucial in the transition of the CCS program from New Horizons North Incorporated in 2019, when the counties were given a 30-day notice that counties would have to take the program in-house. And whereas Val Levno, in her current role as administrator of the Comprehensive Community Services Program, has contributed her expertise for ongoing excellent program reviews. And whereas Ashland County recognizes the excellent and dedicated service that Val Levno has rendered Ashland County Health and Human Services during her employment. And whereas Val Levno will be retiring on May 3rd, 2024. Now therefore be it resolved that the Ashland County Health and Human Services Board, on behalf of the entire county, extends a unanimous vote of thanks and appreciation to Val Levno for her many years of exceptional and faithful service she has provided Ashland County Health and Human Services, and wishes her well in the years ahead. Be it further resolved that the Ashland County Health and Human Services Board, assembled on the 17th day of April 2024, does hereby approve this resolution and recommends it to the full county board for consideration at their next meeting. A second.
I'll second that motion.
We have a motion and second to approve this resolution and forward it to the Ashland County Board. All in favor signify by saying aye.
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 Yes, thank you.
Opposed? Okay, we'll move on. Written materials. Anyone have any questions or comments about the written materials in the packet? Hearing none, we'll move on to board updates, member updates, agenda item request for the next meeting. George?
Yeah, I have an agenda item request. So for several of our committees now, we have put on the agenda, a public access period after the close of business, after the formal meeting is adjourned, which is stated to say that the public has access to bring things up if they're here in conversation, but that there be no actions taken at that time. And that provides that you can talk about something that's not on the agenda. So if someone, because to limit public access to the agenda is very restrictive. So would be my request that this committee consider adding that as an adjunct at the end of our agendas. Might not be utilized very often, but it's nice to tell the public that they can come and talk to us. And you can see that if you go online and look at the agendas for land conservation and ag and extension, you'll see that that's an addendum approved by council to be added at the bottom of our agendas.
I think that's a great idea.
Any other board members have any agenda items or updates that they'd like to make? Laura?
I don't know that well, it doesn't have to be a static agenda item, but as we start out these committees for the 2-year period, we hear a lot about everything that's been done. I would just like to know what the goals are for each next year. So we just started, like, this is our official with the new board members and such, or reorganized structure with Rich in the second seat. But to have what we're looking forward to, whether it comes to fruition or not, what things we're looking out for, what things we could use, just some kind of the proactive part of the plan. I know some pieces in the department have a little more flexibility with that and do look forward, but it's nice to have that as just a pitch-in list and things that the county board might be able to help with if we know somebody's looking in a certain direction, or that the human services board can.
I know in the past, we've had different departments come and talk about some of the programs that they're taking part in. You know, one each board meeting, we got through all the departments, so that might be a good idea again to kind of refresh
Okay.
our memories.
Yeah, even if it's just kind of a bucket list. You never know who's gonna see the thing that you're looking for, or the grant that you're looking for that certain thing, if we don't know you're looking. So,
In our next meeting and every year in the community and service programs, we do go through our evaluation plan for the previous year, which includes our goals for the coming year. So you will be getting that with the community service
you
programs.
do.
Best practice.
Any other comments, Laura?
I guess I'd like to hear more about equine therapy and the benefits to many of our residents who have special needs and have an understanding of the resources, what it does. I think, I know that my daughter went to camp and it was amazing. I mean, she didn't even want to touch a horse or get near a horse. And then when she finally did touch the side of the horse, with trained, it just amazing. They talked about how she was really riding a horse, and then they took her the next step and the next step. And I just came across, because I moved, a picture of her on the horse riding and having, trained people on both sides and someone in front. And knowing that my daughter had access to that and how it changed the projection of her life. And I think most of us don't know a lot about this type of therapy and what goes into it, and the different types of services that are out there. I just feel like, especially when we do things with younger folks, if you put money up front early on, it pays off at the end. It really makes a major contribution to self-esteem, physical therapy, occupational therapy, etc. And so I know when I first joined the board, it was a huge learning curve. And so I really liked some of the suggestions that were brought about, what are we looking for in the future? What services are provided? And then maybe some of the areas, I know, like Penny Rukowski had during her meetings for the children group, bring in different services that are available in the community for those individuals. And it just really opens your eyes to the depth of services that we have in our county. And then we can help other people out to let them know what's available, and maybe highlight one area every time we meet.
we can do that, but like, we do still do that. We have that program still in place where they meet quarterly and they do bring in presenters and so that is happening.
Yeah, well, and I remember us doing stuff with, and I'm foggy now, but like with vaping and, you know, some other things that were presented and, you know, I just wondered if that might be an area that we could look at.
Just as informational.
Yeah, and it wouldn't be highlighting any one company or agency, but rather about services that are available and help our community members.
Well, I guess that would be up to the chairs on, you know. I kind of get mixed messages sometimes of what the board wants, you know, are they action items? Are they informational? It's up to you. So you guys let us know, but I think you kind of need to decide how you want the agenda to go and then direct us that way.
This
So
is Elizabeth Frank. I'd like to see something about sober living in our community and how we as a board can help that expand in the future and where we can look for grant funding or anything to have that be an opportunity for the future. Thank you.
Any other suggestions? You look like you're gonna raise your hand, George.
Move to adjourn.
I do have another business.
Draw my motion.
Okay.
Certified peer specialist, who it was mentioned, and there's another round of that coming up, I believe in Redcliffe, and so, I would encourage people to look at that or to, you know, if you know somebody who you think would be really good at that, to spread the information. I have it somewhere and that I could probably easily access, or perhaps somebody else who's here. Sorry. To encourage a growing, job description, people who do those kinds of things and help other people out. And because they've lived it.
Any other business?
That's you, George.
Register.
Oh.
Move to adjourn.
Second.
All in favor?
Aye.
Well, meeting adjourned.
Thank you.
Thank you, everybody. Have a good night.